I'm analyzing CVS Health. My main argument is that CVS has a real competitive advantage because it is not just a pharmacy anymore. It has pharmacy, insurance, pharmacy benefit management, and direct care under one company. But the other side of that is trust. The more integrated CVS becomes, the more it has to prove that this model actually makes healthcare simpler and better for people and not just more profitable for the company. So I'm going to move through this in 5 sections. First is a quick company overview, then the strategic frameworks, then competitive advantage, recommendations, and then lastly, the reflection and leadership perspective. The first section gives the context for CVS before moving into the actual strategic analysis. CVS Health is no longer just a place where people pick up prescriptions. CVS describes its purpose as simplifying healthcare one person, one family, and one community at a time. The company also frames itself around 4 major areas: health services, health insurance, pharmacy, and prescription drug coverage. That matters because CVS is trying to compete across the patient journey, not just in one part of it. The strategic question is whether CVS can turn that broad footprint into a simpler and more trusted healthcare experience. The history shows a clear strategy. CVS started in 1963 as the Consumer Value Store, added pharmacies in 1967, and then started making bigger moves. Minute Clinic gave CVS walk-in care. Caremark gave CVS pharmacy benefits management. Aetna gave CVS insurance. Signify and Oak Street added home health and value-based primary care. So this wasn't just random growth. The pattern is CVS building more pieces of the healthcare system into one platform. The industry context is why CVS is interesting. CVS had more than $402 billion in revenue in 2025, and its pharmacy and consumer wellness segment filled about 1.8 billion prescriptions on a 30-day equivalent basis. That is a massive scale, but the pharmacy market is also changing because of consolidation, vertical integration, specialty pharmacies, mail order, and e-commerce. On top of that, patients are acting more like healthcare consumers. They want transparency, convenience, and value. So CVS has scale, but it is operating in a market where people are frustrated and competitors keep coming from every angle. Okay, so now I'm moving into the strategic framework application. I used SWLT, Porter's 5 Forces, and value chain analysis because they look at CVS from different angles. So I used SWLT, Porter's 5 Forces, and value chain analysis. SWLT gave the broad picture. 5 Forces showed the industry pressure. Value chain showed where CVS creates value. I chose all of these because CVS is not just a retail pharmacy anymore. It is competing as an integrated healthcare company, so the analysis has to look inside the company and outside at the industry pressure. So the first analysis is pretty clear. CVS strengths are scale, brand recognition, and the integrated model that brings pharmacy, Caremark, Aetna, clinics, and care delivery together. The weaknesses are that CVS is huge and complicated, and that size creates integration problems, debt pressure, and public criticism, especially around PBMSs. The opportunities are AI, care navigation, transparency, and making CVS stores more like healthcare access points. The threats are serious though. CVS faces regulatory scrutiny. Amazon and Walgreens, United Health and Optum, Cigna and Evernorth, independent pharmacy backlash, and broader distrust in the U.S. healthcare system. So the big takeaway is that CVS's strongest advantage is also politically and reputationally pretty sensitive. So Porter's 5 Forces shows CVS operates in a high-pressure industry. The threat of new entrants is low to moderate because it would be hard to build another CVS from scratch, but digital players like Amazon can still enter parts of the market. Supplier power is moderate because CVS depends on drug manufacturers, healthcare labor, providers, and technology vendors. Buyer power is high because patients, employers, insurers, and government programs all want costs down and care simplified. Substitutes are moderate to high because people can use online pharmacies, telehealth, urgent care, independent pharmacies, or competing health plans. And rivalry is also extremely high. CVS cannot just rely on being big, it has to keep proving that its model creates value. So the value chain analysis was probably the most useful to me because it shows where CVS actually creates value. CVS has inputs like drug sourcing, payer contracts, provider networks, physical stores, clinics, data, and distribution systems. Then it has operations like pharmacy fulfillment, claims processing, insurance administration, clinics, primary care, and home health evaluations. The customer touch points are endless. A person might interact with CVS Pharmacy, Aetna, Caremark, Minute Clinic, Oak Street, Signify, the app, mail order, or the specialty pharmacy. The strategic issue is that having all of those pieces only matters if they connect in a way that makes healthcare less confusing for the consumer. If customers experience it as one connected system, then that's value. If they experience it as a difficult maze, then the advantage gets weaker. So, taken all together, the frameworks reveal one central tension. The upside is that CVS has the pieces to make healthcare more connected. Its scale, data, pharmacy footprint, PBM, insurance, and care delivery assets are not easy to copy. But the risk is that the same integration creates scrutiny around competition, transparency, affordability, and trust. So CVS cannot just say integration is good. It has to prove it through better access, lower friction, and better outcomes for the people using the system. So now we're going to move on from frameworks and talk about competitive advantage. Using the resource-based view, CVS's advantage looks real. It is valuable because integration can improve convenience, care coordination, medication access, and member engagement. It is rare because not many companies combine national pharmacy, PBM, insurance, clinics, value-based primary care, and home health at this large of a scale. It is hard to imitate because competitors can copy pieces but not easily copy the whole network, contracts, data, and customer access. CVS is also organized to use these assets, but I do not think the advantage is automatic. CVS only has a sustainable advantage if customers actually experience the model as simpler and more trustworthy. Okay, so now we are going to talk about some recommendations based on the analysis. My recommendations are connected by one theme. CVS should focus less on getting bigger and more on making integration work better. First, they should strengthen AI-enabled care navigation. Second, increase transparency around Caremark and pharmacy network decisions. Third, reposition stores as local healthcare access points. These recommendations support CVS's advantage while addressing its biggest risk at the same time. The first recommendation is for CVS to strengthen AI-enabled care navigation. CVS already has the pieces of an integrated healthcare model, but the real value comes from making those pieces work together for the customer. AI can help identify gaps in care, remind patients about prescriptions, guide members to the right service, and help pharmacists and care teams prioritize people who need support the most. But the point is not to replace human judgment. In healthcare, that would be extremely risky. The better strategy is using AI as a support tool that improves workflow and patient experience while leadership keeps strong oversight around privacy, bias, accuracy, and trust. The second recommendation is increasing transparency around Caremark and pharmacy network decisions. This matters because CVS's vertical integration is a competitive advantage, but it also attracts criticism. When one company has pharmacy stores, a PBM, insurance, and care delivery, people are going to question whether the system is fair. CVS shouldn't wait for regulators, competitors, or independent pharmacies to define their story. Leadership needs to be clear about how decisions are made and how they affect patients, employers, and pharmacies. This isn't just about public relations. Trust is a strategic risk issue, especially with healthcare in the United States. The third recommendation is for CVS to keep repositioning physical stores as local healthcare access points. Retail pharmacy by itself is not enough long term. Customers have online pharmacies, delivery, telehealth, urgent care, and competing health systems. CVS has to make its physical locations matter in a different way. Stores should continue shifting toward vaccines, screenings, chronic condition support, pharmacist consultations, and connections into CVS Care services. That turns the store into a doorway into healthcare and not just a place to pick up prescriptions. So the last section is the reflection and the strategic leadership perspective. And so what this analysis actually means for decision making. The frameworks help me organize the analysis instead of just describing CVS. The first framework showed both sides of the company's position. The second framework showed the industry pressure. And the value chain showed where CVS actually creates value. But the frameworks do not make the decision for you. They organize the facts, but leadership still has to decide what matters most and what trade-offs the company should make. AI was useful in the early parts of this assignment because it helped organize the frameworks and think through how CVS's different business units connect. But AI also has some pretty clear limits. It can make something sound polished even when the reasoning is too general or sometimes incorrect. I independently picked all of the sources for this presentation and went through and decided what actually mattered. My disclosure is that AI was used for brainstorming, organization, and editing support. The final analysis, source selection, and recommendations were reviewed and shaped by me. From a strategic leadership perspective, these findings will help CVS executives decide where the company should go next. A senior strategist would see that CVS's biggest advantage is integration, but integration alone is not enough. Leadership should allocate resources towards the areas that make the model work better. AI-enabled care navigation, pharmacy workflow, Caremark transparency, and store-based care access. The point is not just growth. CVS is already huge. The bigger question is whether CVS can make its scale work better for patients, employees, payers, and communities. The leadership qualities needed are not just technical. CVS leaders need ethical judgment because healthcare decisions affect access, affordability, privacy, and trust. They also need data-informed decision-making, but the data cannot be the whole story. If CVS only becomes more efficient, but people still feel confused or exploited, then the strategy fails. Leaders also need change management skills because CVS is a large organization with many moving parts. AI, transparency, and store repositioning all require training, communication, and accountability. A good strategy is not just what CVS can do, it's what they can do responsibly. So, in conclusion, overall, CVS Health has a real competitive advantage because of its integrated healthcare ecosystem. But the company's future depends on whether leadership can make that integration work in a way people actually trust. CVS does not just need to be bigger. It does not just need to acquire more. It needs to be clearer, more connected, and more accountable. That is how the company can protect its competitive position while responding to the real problems in the healthcare system. And so these are my references. I pulled a lot from CVS Health and the CVS Health Corporation. And then, of course, I used the textbook and then some other scholarly articles as well.